Thank you for joining us today. We are Health Disruptor, connecting healthcare innovators. We're at www.healthdisruptor.com. Today we're going to talk about travel insurance in today's pandemic world. Our speaker is Rick Heagle. He's an agency owner for cruise planners in Rancho, Mirage, California. He has over 40 years experience in national and international casualty claims as a regional manager and a claims manager for large international insurance claims organizations. He also has had his own consulting insurance business for over 20 years. And since 2016, he's been an agency owner with cruise planners and a designated travel insurance specialist. Thank you for joining us today, Rick. Rick, maybe if we could start with what is travel insurance and why do I even need it?
Travel insurance is a personal coverage that people acquire typically for overseas travel. And the reason you need it is because the insurance that you're provided domestically does not travel beyond the borders of Canada and the US.
So typical travel insurance as we probably know it in the past is covering, baggage loss and trip cancellation and things like that. I think some things we don't always think about when we're traveling is if we're domestic, of course, we're looking at our own, healthcare coverage if we have it to cover some kind of event. But obviously, internationally, that's not the case. So what are some of the options for health coverage? And maybe if you could talk about some of the exclusions and inclusions.
Well, the significant areas of travel insurance for today's environment with the pandemic are the emergency medical and dental coverage that is provided under travel insurance, and the emergency transportation that is provided. Those two covers allow a person who suffers an illness while traveling to receive coverage for medical expenses in excess of the coverage limit of the basic policy, which is usually to cover only the cost of the travel. It also includes the dental coverage for $500, and significantly the emergency transportation is important if a client receives a diagnosis of COVID and is quarantined overseas. Returning and the expenses involved can be significant.
So internationally, it becomes the primary insurance. Is that correct? Until somebody is repatriated back to their own insurance carrier?
That's correct, because some of the original travel insurance policies were what were called an excess cover. That is to say, they would apply only after your primary coverage provided by your individual plan had paid a claim. That was a big problem because many people were whipsawed between the two carriers, and now the travel insurance industry has stepped up and said they will be primary, and that solves that problem.
If we could briefly talk about COVID and how that's incorporated into travel insurance, since I think that's the hot issue right now. And initially when the pandemic started, COVID wasn't covered in many policies. So is it covered now? Do you have to request that it be covered? Can you just briefly explain that?
Well, I think we all know that COVID exposure became a recognized epidemic as of February 3rd, 2020. At that time, the insurance carriers were not aware of the scope or the extent of the risk involved, and even to this day it hasn't been finalized. But in response to it, what they did is they created a novel coronavirus endorsement, which is an epidemic coverage endorsement and a special plan accommodation for COVID-19.
So the insurance would cover whether it was, or the travel insurance would cover whether it was land or sea. It's not exclusive of any type of particular travel. Is that correct?
That's correct. The purpose of travel insurance, because people travel on various entities, whether it's a ship, an airplane, train, it's always typically foreign. And because of that, the coverage is broadened to cover just about anything while you're away from your home domicile in the course of travel.
What about when do you need to obtain coverage? Is it the time you book the trip, or is it right before you're ready to leave, or when you pay for it in full? When is it required to purchase?
Well, it's not actually required to be purchased at all, but it's always recommended by travel advisors. In fact, many companies like ours insist that if you refuse it, that you sign a waiver acknowledging that you were at least offered it. The reason that people purchase early is because many policies have a cover for previously existing conditions that if you purchase the insurance within 14 days of the booking, those pre-existing conditions are covered as part of the insurance.
I know this would probably vary from policy to policy, vendor to vendor, or carrier to carrier, and even might be predicated on your age and cost of trip. But can you give me a general, or our listeners a general idea, what is the typical cost of
Again,
travel
depending
insurance?
on the age and the extent of the trip, the coverage is typically limited to $20,000 for trip cancellation. It's the trip interruption coverage is $30,000, and for a young couple, the cost is usually less than $500 for a typical 7-day vacation.
What do you suggest that individuals do before they actually sign on the dotted line or purchase the insurance? What do they need to review?
As with any significant purchase, you need to do your own investigation concerning the details of the cover, the terms and conditions, and also the limits that are involved. And of course, in many instances, there are some exclusions that pertain only to certain parts of the policy. That's why companies usually allow you to review the policy itself, and it's required in many states to have a look and see of 10 days or to 14 days before you actually you can actually return the cover if it's not to your expectation.
What if I do have a pre-existing condition and I purchase the insurance within that 14-day time frame, and but I'm not traveling till possibly 3 or 4 months ahead of time? What would happen if I did get sick? And
well, that's the advantage of buying the policy early, because most people, when they're booking travel or booking into the future, depending on the type of travel, it can be up to almost a year from the purchase. So many intervening events can transpire, and if you have the pre-existing conditions, the cover starts at the purchase date and continues until the end of travel. So if in the intervening period you have a medical situation, be it pre-existing or not, it would be subject to the cover.
Thank you, Rick. Well, this is a pretty, in-depth, topic, and we could probably go on for a long time, but maybe we can talk a little bit about, where I can get additional information. If you have additional questions about today's topic, feel free to reach out to Rick Heagle at cruiseplanners.com or contact him through his website, www.getawaysmooth.com. You can also reach out to us at Help Disruptor through our email at helpdisruptor@gmail.com with any questions you may have, and we'll forward those on to Rick. Additionally, although we're not endorsing any particular travel insurance vendor, Allianz Insurance has a great FAQ on their website, and the link is right here. So thanks again for joining us today, and we look forward to having you sit in on another topic soon. Thank you.